tremendous opportunity and point of satisfaction to be able to see what so many people like you are doing around the world. And as I said in my remarks last night, you're not alone in this journey that you are engaged in. There are literally hundreds of thousands of people that we connect with, even more that we're working to reach, that are doing the same things that you are. And it's learning from those others that really is part of that message that I bring to audiences around the world. And as Russ said, and I want your ACHE slide, I love that one in terms of the top issues that are facing executives in healthcare, and I agree with you. Take technology off the list because every one of those issues very much is dependent upon technology. And we're going to talk a little bit about one of those, quality, and how technology and data drive improvements in quality. Now, I'm not a physician. I have no medical background, but I do feel that I play a critical role in better quality and better health care, better patient outcomes. And everyone who is in this audience, whether you are a clinician, whether you're an IT professional, a technician, a technologist, or whatever, you too also have that responsibility of taking ownership of the things that IT does in terms of reducing medical errors, improving patient safety, addressing the issues of cost, quality, and access. Apparently you think everybody knows HIMSS. Just in case you don't, just a quick slide or two about who we are. We are a not-for-profit organization focused globally, very much with the vision of better health through IT. We engage over 300,000 people around the world in this, of all different types. As I said, regardless of whether you are a clinician, IT professional, a non-IT healthcare executive, those are people that we very much engage in around the world. How we do this is through many different ways. We work directly with governments in terms of development and monitoring and measuring national health policy. We work with individuals and individual organizations in terms of how they achieve their strategic health objectives as well. And so, why do we do this? That really is the key point, and it's part of the title of my presentation, quality. That really is what we are talking about when we are talking about better health care. There are other aspects as well, such as driving costs down, getting more for the investment that we put into health care. But very much a cornerstone is quality. And we see what is happening in our institutions today on the slide. We know these things are true as much as we may want to believe otherwise. We do know that people are being harmed while we are attempting to treat them and make them better. And so we need to find out, as Russ said, how to absolutely eliminate error. It's not lower the error rate, but eliminate them. So how do we do that? And that's going to be what we're going to be getting into in just a minute. But one more statement I want to make is a statement that's also hard for people to accept. And that statement is, you're really not special. And what I mean by that is you're not unique. You don't really have problems that no one else has. You look at this list, and I can't believe that there's not a one of these that isn't a quality issue that you're addressing. Well, guess what? This list I use in my presentations in the United States, in Australia, in Korea, in Germany. It doesn't matter because we all are dealing with these same issues, which is why, back to the slide Russ used, all of these issues are dependent upon technology because that is going to be the primary way that we're going to address those types of issues. So what I'm going to do To help you get to Russ's 3.0, Transformational Leader, I'm going to share with you some tools that I think will help you on that journey, that will help you professionally as well as help the institutions you work for and absolutely help the patients that you serve. One of the things that we found is that there is an absolute correlation between advanced EMR capabilities and quality. We had a session yesterday where there was a little debate about healthcare IT, and is it a bane or is it a boon? Exactly, what is its value? My belief and the belief that my organization stands for is IT is absolutely necessary for us to achieve those high levels of quality, and if you follow along certain paths, you will get there. The data are irrefutable in how technology will achieve these outcomes. What we've developed is a global model. It is the model that has been developed with input from professionals such as yourselves from all over the world. So it is not a model that only works in or is drawn upon one set of experiences in one part of the world, but very much a global model. And no, there's not going to be a stage 8, 9, or 10. What we're going to do is we're going to move the net on you periodically, and it's going to get harder and harder to score that goal as we change the model. As the world evolves, our world evolves, technology evolves, the tools that and resources that we use become more sophisticated, our expectations will get higher, and we will move that objective of the highest levels of adoption and therefore quality will be harder and harder to achieve that highest designation as we develop. The model does, and I'm going to identify here, we've got I think about 6 hospitals in India who are at stage 6. But the real value of the model that I'm going to share with you here in a minute is not, are you at that highest level or not? Yes, that's an objective, that's a goal. But getting there is so important because you can waste a lot of resources wandering a path, straying off the path, making some U-turns, doing some other things, and wasting resources getting to an objective where we have found, while not an absolute blueprint, it is a pathway that will get you and your institutions and the patients you serve to a better place. This is the model, and I think maybe on the center screen it's big enough where you can see basically what it's made up of. And it's made up of a series of significant or major IT applications, each of which are meant to achieve certain objectives. At the lower levels, your stage 1 and 2, is really about data capture. It's the ability to achieve the beginnings of a repository of data that serves as a foundation for the stages that will follow. We get into 3, 4, and 5, and here we're talking about clinical tools, clinical decision support, starting to use that data in making decisions. And then you get to 6 and 7, where you are starting to achieve those very highest levels of not only capture and decision support, but moving into analytics. You have complete clinical decision support systems. Very important in terms of having closed-loop medication administration, because research shows the place where you are most likely to make errors is in medication administration. That is where the highest volume of medical error exists. Those are very important pieces to bring in before you get to stage 7, which is a completely digital hospital. All of the information is flowing into a central record. It is accessible by the right practitioner at the right time about the right patient. It has the ability to start to share that information, which I'll touch on a little bit later in the next model. As I said earlier, we do have 6 hospitals, 4 at Apollo and 2 at Max, who have reached stage 6. I'm not going to say these are the only 6 in India. These are just the only 6 that have reached out to us and said, come to our institution and tell us how we're doing. I think there are probably more in the country who are at this stage, and there are many of you who are at 4 and 5, who are at that threshold of going to the next level. And that's what I say about the importance of the model is it's not for you to go away and work on this in the absence of leveraging knowledge from around the world about how to get to the next place. Let us talk with you about doing the gap analysis and doing the planning, helping you do the planning to move up so that you can join this group of hospitals. Because it really is important to focus on the journey as well as the outcome. As I said, there is correlation in our minds about advanced EMR adoption and outcomes. This one's from Health Grades about the relationship between EMR capabilities and better adjusted mortality rates. Leapfrog in terms of their hospital safety grade. These are American examples. We've done research in other parts of the world. Again, very clear correlation between the stage models and the leapfrog measures. And then around profitability as measured, and this is where we do find uniqueness depending upon how your health system operates and how your reimbursement systems operate. But in the United States, clearly, very strong positive correlation between stage level and profitability, to the point where the bond rating agencies in the United States, the agencies that rate the hospitals for the purposes of borrowing money, now look at those at stage 6 and stage 7 in order to attain the highest level of bond rating. That is a near requirement now. And this is not something, as I said before, that is uniquely done in the United States. It is something that we are engaged in all over the world. And here are some examples of some places where we are working at individual hospital, regional health authorities, or nationally in terms of assessing the capabilities and direction that's going on within hospitals in those countries. So the second part that I want to talk about is how IT drives delivery transformation. So we were talking about in the first model a measure of IT adoption and maturity in a single institution. Well, as we all know, care is not delivered in one place. It's delivered over a continuum of care and across a multitude of places. A person doesn't also follow in a straight line of the first place they go is to a general practitioner, and then the next place may be a clinic, and then maybe to a specialist, and then the hospital, and then into post-acute care. They move all around. And so understanding that the continuity of care is extremely important is, I think, the second step that we need to touch on when we're understanding quality. So we've developed a tool for you here as well, very much focused on the continuity of care. And again, it's much like the design of MRAM, that you have to first build some basic capabilities, develop them and use them internally, and then start to build your capability, because we're talking about continuity, the ability to move that data externally to the final optimization of that, where you truly have multi-vendor, which is very important in parts of the world where you have literally hundreds of vendors that are operating in a single hospital or system. You have multi-vendor, multi-organizational interconnectedness so that the data flow easily and seamlessly from place to place at the right time. So again, I've run quickly over the key aspects of it. The model is designed very similarly around MRAM. It very much is meant to engage a broad spectrum of players because we are dealing with continuity. So it is best applied in a community setting with agreement among multiple practitioners and practitioner groups so that you can truly measure how well things are occurring between different systems, between different types of care delivery organizations. In both of these cases, the execution of scoring of these tools is really a very basic and simple assessment tool and study. The added value that we do is not just simply produce a score for you, but we provide analysis as well to help you understand what does that mean. What are the barriers you're encountering, whether it's MRAM, continuity of care? What are the barriers you are realizing to get to the next levels? And the idea is for you to factor these results into your internal planning about where you're trying to go and the strategic objectives that you're trying to achieve. And then the third model is where we all hopefully are headed, and that's the use of analytics and going beyond these basic systems. Analytics operates on a curve just as most anything else does, which goes from basic to advanced. We all start out in an area of descriptive analytics. We're describing something. What we ultimately want to get to is predictive analytics. I can anticipate what's going to happen by virtue of analyzing things that have gone on before in the way of in healthcare, in the way of similar cases. With genomics, we are now able to sequence not only the person but also the disease. By matching those things together and finding similar cases where those same factors, those same basic designs exist, we're able through analytics to determine what the best course of action is, and we know which ones are more likely to drive the outcomes we're expecting. So again, we've got a tool for you. We've developed a model, and it very much, as with all of the models, provides a roadmap, helps you convey a vision about what you're trying to achieve. Here's the description of the analytics maturity adoption model. It, again, very much is designed around the concepts of before. It brings in aspects such as governance, data governance. It very much also, as the others have, includes aspects around infrastructure. It builds in, because we know this is early stage for most organizations, it builds in the ability to map competency growth, because we know on this particular model there probably are very, very few, if any, at the top stages of this. This is starting to get where Russ talked about. Everybody's performing very, very well on a lot of those areas on his list. Very few are at that point. Again, the model is very straightforward for you to follow. The assessment is a very straightforward one, and it will find where you are on this model and identify for you where those places are for you to begin to focus in a logical sequence of steps in order to achieve a higher level of analytics maturity. So, in summarizing, these are what we see as, from our perspective, these are not the only building blocks to quality, because you've also got to have clinical competency and so many others. But from where we sit, from where this audience sits, we do see it's very important to have sophisticated IT adoption, continuity of care, and then ultimately that point of utilizing analytics. Thank you very much for your time today.